All right. And we're recording. Okay. Well, welcome this morning. We're going to be doing some more gentle yoga and self massage for helping with lung care, but in particular, helping to drain mucus from the lungs. And I'll be starting seated. And also, mucus from our sinuses, which when we originally get sick, our sinuses can become congested. Our sinuses are a filtration system for um, illnesses, viruses in the air, and that the mucus catches it, and then it'll drain in our body. It'll drain by moving down our throat and out of our digestive tract, or it just drains directly out the nose, which we'll be kind of looking at some different ways. And then we'll also be tapping into just some subtle awareness of the lymphatic system in the body as well, which is another sort of filter to filter out any toxins or illnesses, viruses or bacteria in the body once it's in the bloodstream. So the sinuses catch it before it gets in the bloodstream, and then once it gets into the bloodstream, the lymph is a kind of next level agent of protection. And so then if that virus or that illness gets into our lungs, which it could be breathed in, if we have that mucus kind of in our throat, it's really close to the airways, then we can start to develop that virus in the lungs. So, and as well, there's other reasons why the lungs might be inflamed with allergies and other reasons for the body to become inflamed, the tissues to become inflamed, and then secrete mucus to try to clean out. So we're just going to be doing a lot of cleaning today, and just having a subtle awareness of these different systems as we do some similar shapes that we've been doing. Can you guys hear me okay? It's making a funny noise. Okay. So let us begin seated. And so if you're sitting in a chair or even just sitting on the floor, having an easeful erect posture where you're towards the front of the chair, your feet are below your knees, and your pelvis is like a bowl of water. So you're not sitting back into the chair really stable. You can have a little cushion behind you to support, sort of wedging between your sacrum and the back of the chair if that feels supportive for you. And let's close our eyes. Maybe you have some nice birds outside like I do. And or just whatever the sounds are in your environment. Taking those in, taking in this space that you're practicing in, this little nook supporting you, going inward. And then maybe, if it feels good, you can place one hand on your belly, your low belly, and another one on about your heart, maybe between the heart and the upper belly. Just really wherever feels resonant. Just feel deep to the hands, into the body. Feel the body breathing. And just get a sense of how you're feeling right now in your body, how the breath feels, how the body feels. And checking in, no right or wrong. And then tapping in for a moment to this deeper intention that you have for being here today. So whether it's learning more about ways to help heal your lungs, maybe it's just coming into a place of center, maybe it's having community, maybe it's all the above. Be with that intention, with your breath, with your body, the sensations you feel. Good. And so we'll take these hands, and you can open them out like they're receptively opening towards the space. Maybe the space of the intention you've created, the space of this room, the space of your presence. And then we're going to simply bring them up towards our face. And if you have glasses on, you might want to take them off. And gently cup your eyes, letting your face rest into your hand. And then we'll take the hands down, and you can lower them all the way, or you can let them hover. Breath in, let your face and body lift. Then we'll go back and forth. So it's kind of like a cat-cow in the spine. You can just pause there for a moment at the end of the breath, and then as you inhale, lower the hand. So this is this very calming, soothing gesture, bringing us more inward with our intention, with our presence, with our breath. We're also getting the fluids, the tissues and the fluids moving in our body, in our belly, in our chest, in our lungs, and in our face. Good. One more of these. And then the next time the hands come up, you can remain there. Just letting the face be resting towards the hands, and feel your body still maybe breathing a bit, maybe lifting as you inhale. And releasing more as you exhale. Just feel that supportive presence of your hands, that soothing presence. And maybe also start to sense the structures in the face. So if you are congested, you might feel more pressure towards the face, towards the mask of the face. Just get a sense of what you feel. Do you get a sense of deeper congestion, maybe behind the eyes? Good. And then we'll come up, and notice when you come upright, does that have a different sensation in your face? We'll come back to doing some massage in this region, but first let's now roll the shoulders. So we want to get the physical body moving, not only to create just comfort and ease in how we feel, but also to mobilize the fascia, tissues. And so there's all these little lymph vessels and lymph nodules that are also encased in the fascia, all around your neck and your chest, all down your along the central tract, all through the whole body. So just maybe just sense this fluid body, not only the lymph, but even the blood, how it's enjoying this movement. One more. Good. And then we're going to take the hands to the front of the knees. Big breath, or easeful, but longer breath in through the nose. Lifting the chest, doing a little arch in the back. I'll do a side view. And now as you exhale, really draw your navel back. So we're doing a little bit more of a cat-cow. Pause there. And then inhale as you come up. You can even slide your hands back. And this time, stick out your tongue as you exhale. Close your mouth, inhale through the nose. So a few more lion's breath. So we're starting to work all those tissues in the mouth and the throat, the palate of the mouth. When we stick out the tongue, you can really sense that dome at the top of the roof of the mouth. The sinuses are right above it. And just notice when you do that, that's how all those structures feel. And then also you're moving your gut. diaphragm, all these deeper structures. Last one. Good. And then we'll take a little rotation. So slide one hand up the thigh, turning, and then come back to center. Inhale as you open the other side. And then exhale, center. I'm just doing a little twist. And as we've discussed in past classes, you can really refine how you're moving, coming to the end of the breath with a little pause, and then wait for that next breath. And then it's like you're just following the breath. You're waiting here for the pause. The breath starts, and then the movement joins. And this can be very soothing for your mind, your nervous system. It can bring you into more efficient movement where you're not overcompensating at the tissue level. And also maybe this deeper curiosity of how the lungs are being affected here, again, the fluids of the body. And after you've done what feels like an even number, back to center. And then we'll do another stretch that gets some more of the structures. Feels good. So we can take our hands out in front, slide the hand up and through the armpit, and then you're just rotating the head at the same time. Good. And then we can take the hand down, lifting the arm up, and then body over. So inhale back up. And then exhale, coming down. So we're going to do the same arm. Inhale. And we're opening all of these structures in the neck and the chest. Exhale along the side body. Feel that inhale draw you up. Good. One more. You can imagine the deeper structures of the fluids, the blood, the lymph, especially pulling that lymph right at those nodules at the armpit. You might even notice the pressures in the face, the sinuses changing a bit. It's not to give you too much to think about, but just kind of being in this deeper presence of just, what do I feel? What do I feel when I do this? And so we'll do the other side, trusting all these deeper structures. You might even just kind of let your mind go to this more general awareness of water, this fluid nature, deep to these movements. And I'm inhaling as I open. If you find sort of a different breathing pattern, a movement combination that feels good, exhaling as I cross. And listen to what really comes natural. There's not really a right or wrong. Just about being safe, listening to sensations in your body. One more. Or just finding that balance in your body. Good. Pausing center. And so we just did some really nice side movement with the neck. You can do it one more time, just isolated here. And notice if when you're sitting, if your body has a habit of the head pulling forward, the shoulders pulling forward, so just kind of sensing the head right over the body as you rotate the head. And as you're doing this too, just a curiosity, a relaxation through the jaw and the palate of the mouth. When you bring attention to the palate, um, is there a different sensation? Is there a subtle, different pathway release? Good. And then next time you're center, once you've done both sides evenly, then we'll do a gentle head tilt to one side, center. Being gentle with yourself here. Then we can pause on this one side and even sort of turn the head to look down. Option, bring the other hand back. You can even rotate it. Just find where you feel a stretch. And again, how does it feel inside your mouth? Do you have a habit of gritting your teeth? How does it feel to have a softness there in the mouth? Replicating that softness in your breath and your body. Good. And then we can release and then do the other side. So tilting the head, tiny rotation. So we're giving a nice stretch to some of these muscles in the neck, which when they are released, they can help to also release some of those pathways where the fluid really can get bogged down. One more breath there. Good. And come back to center. And maybe one more shoulder roll. Shake it out a little if that feels good. A little shimmy, shimmy. Just want to check my notes here. I have this nice little, yeah, okay. So I wanted to get some movement in our bodies first to really help to stimulate that movement of tissue, movement of fluid, so that when we start to go into the direct drainage techniques, that there's somewhere to drain to. You might want to have some tissues close by, especially if you are a little stuffy. I have mine. I've been stuffy. Allergies are amplified this time of year, as well as any kind of illnesses going on, and there's a lot of reasons for stuffiness. So we'll be doing a couple breathing techniques as well as self-massage. And with any breathing techniques, oh yeah, okay. With these breathing techniques, just being very attentive to how your body responds. And if you do have any conditions with your heart, high blood pressure, glaucoma, just anything where there's a lot of any buildup of pressure is contraindicated for you, or just something to be aware of. Just go very lightly or consult a doctor before doing any of these. But actually, before we do the breathing technique, I did want to have us do a little bit of lymphatic massage for the neck. So we just got everything moved with some stretches. So we can take our hands and cross them and find the collarbones, and then just above the collarbones, so you feel these little notches where there's this kind of little V. It's kind of just to the side of there and above. There's some lymph nodes, and also these are kind of on an area where there's some major ducts that the lymph dumps into the bloodstream. And so we're just gently massaging it. I'm doing little sort of circles with the fingers. You can also just go up and down. And the lymph is just under, there are these vessels just under the skin. And so it's very light. So it's like, just even pause your fingers there, sense the skin, and sense one layer deep. And then pretend like you're just gently pumping that tissue. It's so light. And we're opening up these this area where the lymph can then drain into. Good. And then we can take our hands, and I think I like to take it each hand here, but you might find it's easier. You can even do just one side at a time. So we're going to come up to the top of the neck. We have this big muscle here in the neck. We're going to come up to the top of it. You might even feel these little bony landmarks behind the ear at the base of the skull. And we're just going to gently pull down. And your mind is thinking deep to the skin. So you're not just pulling on the surface of the skin. Your fingertips are almost energetically or just mentally connecting to that deeper surface. And so you can just pull, or you can do sort of that same gentle coaxing, coming all the way down. Just doing that all the way down. You might start to feel some clearing in your face and your throat. You might start to feel just different sensations of pressure as things are draining. You might not feel much at all. Then we can take our hands. I like to take my pointer finger right behind the ear. If you open and close the jaw, you'll feel that little spot there. And actually maybe even the pointer and middle finger, really just kind of where it feels comfortable to place your hands. And it's kind of tissue there, and it might feel boggy. And so again, just sensing that deeper squeeging of the tissues, kind of massage in there for a moment. You can relax your mouth. So you can imagine in a habitual jaw tension, that muscular tension could impede the flow of fluids. It's also just, let's make things tense. And then we're going to come and glide along the actual, some of the lymph nodes under the chin. So right at where your doctor might feel. And gently, again, glide, not just on the skin, but just feel like you're gently coaxing. Come all the way. So you're moving this whole area all the way up to this part of the chin. And then we'll come up to the face and up to the temples. And then just sustain like a gentle medial pressure. So you're pressing inward very gently. And notice, is there any bogginess there? So you'll feel a sense of puffiness or boggy in your fingertips. And then also in your body, to the touch, you might feel some sensitivity. And so just going so gentle, you could even sort of do just micro in and out. Imagine you're helping to stimulate movement of the fluid. Good. And then coming down, again, sort of through the outer jaw area. And we'll go back the way we came, pausing behind the ears. Just gently rub in that area. And use your intuition. You know, I find sometimes even for me, just a sustained, very light pressure with a slight pulling down. I'm just feeling for a sensation of release. But your body might prefer that gentle coaxing. And then we'll come down through the neck again. Good. And then we can be at the top of the collarbones one more time. So you might notice some different sensations in the face have changed. You might not. And then shake it out. Take a breath. So now we'll do some of our pranayama to clear the pathways even more. So we've introduced this in the past. It's called the Kapalabhati, fire breathing. So again, you might have your Kleenex close by. And we're just focusing on a strong exhalation. It's like when you blow your nose. Yep. It's gonna help you get it out. So it's just exhale, 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 exhale. The inhale is just involuntarily coming. It's so light, you don't have to focus on it. So it's obviously a big burst of air helping to clear out the sinuses, and you're doing that through getting a lot of working through the abs and really releasing through the diaphragm. So it's doing a lot of good stuff, not only for the sinuses, but the lungs and the tummy and all these areas. Then relax. Take a breath in and out. Good. And we'll do that one more time. And at the very end, we'll do just a long blow. And that's a slightly different breathing technique called Bastrika. So we'll do about 5 to 10 fire breaths, just quick, 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 quick. And then blow, hold it out. You're really using the abs to draw it out. Good. So you could do that sequence of 5 to 10 fire breaths with that long blow about 3 to 6 times. You don't want to do it too much, especially you don't want to create any kind of lightheadedness or any of those conditions we talked about. So now that we have created some drainage, we've created some airflow, let's do a little bit more now with actually touching the sinuses with breathing and then massage. So in yoga, we have these alternate nostril breathing techniques that really help to open the airways and just bring more awareness to this area. So you can take your thumb over the right nose and your ring and baby finger over the left. And you'll feel there's a bony part, and then when you plug it, your nose is plugged. So have your thumb over your right nose and close it up. And so we're just going to focus on the inhale. So we're going to inhale through the left. And then exhale through both. You can lower that hand. And then take the other 2 fingers, close the left, inhale through the right. And then lower down, exhale. So if you're really stuffy, this might be challenging. And I noticed for my body, my left side is chronically more stuffy. So when you're going to breathe in through the stuffy side, you can take your other fingers to the skin and gently pull away. So closing one side, open side needs some help, so you use the fingers to pull the skin away. And you can kind of find some points. So and you're also releasing and opening the sinuses. Maybe it's a little lower, maybe it's a little higher. You'll find that point where when you put pressure and maybe a little bit of pull, it'll all of a sudden open. So just inhaling, finding that where you might need that opening, and then exhale. And if the other one's clear, just breathe normal. But if you need the other one, find that thumb, finding that point that feels, again, it'll feel boggy, and maybe your body to the touch, it'll feel sensitive, and you'll feel it start to open. So just doing this back and forth a few times. Inhale, exhale both. Inhale, exhale both. Option, using that opposite hand to help pull and open the sinuses. And so after you've done what feels like an even amount for your body, just see how your breathing feels now. Good. And then so we'll come to the sinuses and actually just do some massage. So right maybe where your glasses might lie. Gently press again medially, so you're pressing your fingers towards each other, just the sustained pressure. And maybe again, like when we did the temples, it's kind of in and out, very, very micro, maybe a little bit of massage. So your fingers are sensing deep to the skin and then deep to the sinus tissue, sensing that hollow space and sensing bringing opening, bringing awareness to that space. And then so you can start to move further out and do the same thing, pressing towards the face gently. And you can do that in and out. Or you can also do a little tiny circle. And so if you feel a spot that feels really congested, you also might try positioning differently with gravity. So maybe leaning forward and seeing if that gets it to move. And you might all of a sudden just get like waterworks. And so if you are ill or if you have stuffy nose, getting it to drain is the best thing because it just gets it out of your body. It doesn't go down into your throat, getting the chance to get stuck there or get pulled into the airways. It just comes out. So you can even just be here, kind of just find different points of pressure. You can even go down now by the lower the nose and just feel all around. So your sinuses are all in this area, different ones here and here, and just explore pressure, how much you're doing with your hands, explore sensation and response, and explore positioning with gravity. I'll even do this in my bed, laying on my stomach, kind of propped up on my pillow, and just let it all flow. And of course you can do steams. Those are a great way to get everything flowing. Yogis have used the neti pot, doing saline solution to rinse. So those are all ways to help get things out. Good. So then another sinus area is all the way up, and you can even take your thumbs and hook them in the inner eye sockets. And again, if you're having some sinus congestion, you'll feel some pressure in your body, and then also you might feel some bogginess in your thumbs. And so again, you're just doing that gentle oscillation of pressure and release, or little circles, or just sustained pressure but feeling for a release deeper. And then you can like you're going to pinch your eyebrows, and so we have more sinuses up here. How does it feel there? How does it feel if you change position? And also when we're leaning forward like this, there's also a bit of lung drainage that's happening, just this slight upright forward. So we're using our self-diagnosis of noticing sensation, noticing what feels good, what feels like it's releasing. Like, oh, I'm in this position and I feel more release in my face, or I feel a release through my breathing. So start to make your way across the eyebrows now into the temples. So that's another sinus, kind of deep into there. And then like we did before, that sustained medial pressure, or this micro in and out, or micro circles. And we're also not only moving that deeper mucus, and we're moving the lymph, which is helping to drain the mucus, but we're also moving the fascia, the fascial tissue, this connective tissue that surrounds the sinuses, surrounds the blood and the lymph vessels and the cells. And so there's just a lot going on. You don't have to understand it. You just are feeling. Good. And then we'll make our way. So we're kind of coming, feel the jawbone coming back around, and once again, wrapping our way in through here. And then let your touch just go intuitive. So if you just want to even just, it's like when you wash your face, You might even imagine you're moving this energy, like you're giving yourself an energy massage, an energy face wash, even through the back of the neck. How does your body want to be touched? A few more moments of exploration led by what provides real release for your body. Good. And then so once you're done, you can shake it out. We can do another lion's breath. And at the top, as you inhale, just pause for a moment. Pause on that inhale, pause where the head is. Imagine everything draining, and then as you exhale again. One or two more of those. Good. Feeling okay? All right, we're gonna do one more seated massage. Yes. So we're kind of taking care of this whole upper part of the body, and now we're going to be thinking about the lungs. So we're going to be bringing in this massage that we'll be doing in other positions laying down. So our hands are cupped in this cup position. And if you guys did the first class with me, we did this then. We're just going to be adding on. So back and forth sort of rapidly, and a comfortable pressure and weight to the hands. You're not pushing really hard, but you can, if you have some deep congestion, that deeper pressure will be helpful. Moving all along the sternum. You might just imagine all of the lungs opening up underneath this vibratory massage. So this is a little hard to do on your back body, so I'm going to be bringing in a model. Hopefully the kiddos will be up for it. And when you're ready, you can do the other side. But there's still a lot you can do to help open through the front of the body, the upper body. When we're looking at COVID especially, it's a lower, so keep going all around, it's a lower respiratory illness, and it kind of attacks the lower lobes. And it's easiest to access the lower lobes through the back body. So again, when we get to that demonstration, you'll feel that. But you can also get lots released through the front and side body. Good. Shake it out. Roll up the shoulders one more time. So you might notice your breathing might feel a bit easier, not only through your nose, but through your lungs. And now we'll do just a little bit of movement in standing to get more parts of the body moving. Come on up to standing. And we have a chair to support how far forward we're going to be bending forward. We've been doing this coupling of a warrior stance into a split leg forward bend. And your feet are about hip distance apart. And your front knee can bend here. And your arms can open, just a comfortable position. So thinking back to your sinuses. So if your sinuses are sort of a major focus, you're doing this practice to help relieve sinus congestion. We're inhaling and taking a little pause and just sensing everything releasing, draining into the body. And then as you exhale, you can straighten out the leg, let the body come neutral. So we're gonna inhale, maybe the arms wanna come a little higher. Pause, and exhale. Now, if you wanna take it a little bit deeper to get more movement into the tissues of the lower body, more different positioning of the lungs and gravity, and if it feels okay in your sinuses, as you exhale, we can come forward and stay one breath. And opening up, staying one breath. Assessing, how does my body feel? So if I'm feeling discomfort in my sinuses when I come forward, I can just stay upright. If it feels actually really good to be here, we can stay a little bit longer. And we can even go lower. So like we have done in the past, we're here, and then we exhale, coming forward. Coming farther forward also gives more drainage to the lungs. It gives more mobilization of all those deeper structures of the diaphragm. And all of this, whatever you're doing, is helping just this rhythmic movement back and forth with the legs and the upper body, however deep you're going. That rhythmic movement is moving your blood. When you're moving your blood, you're moving your lymph. So all of this rhythmic movement, that's why they say going out and going for a walk is one of the best things you can do. Or just doing these gentle rhythmic yoga postures. Finish off your last one. So whatever, you're really tailoring it. And you're tailoring it to, how do I feel? What feels good? If I was working with you individually, I would be helping assess your response, and we would come up with something individualized. But since this is just sort of a general class to try to give the tools and the idea behind the tools so you can individualize it. Now just pause for a moment, see how it feels. Good. And then we'll do the other side. So again, starting with that, just that upright inhale with pause. And then remaining upright. Or if we want to come to the chair, to the upper part of the chair, we can inhale up, exhale down. And a few more of these. What depth feels good for your body? And there's a lot of different things to think about. The tissues, your back, muscles, but when we're looking at that deeper fluid body, having your mind assess that. How does this feel for my sinuses? How does this feel for my breathing? Does my breathing feel more easeful when I go further down? And trusting that deeper reasoning behind the positioning, what it's doing to the structures, the tissues, the fluids. So once you finish off what feels like an even amount, Come back to center. Good. And then we can do almost like a nice wide leg stance, comfortably bending down, and then reach the arms up. Good. And then exhale down. Good. One more time. Inhale, reaching up. Option lifting the face, pausing with the breath. Now we'll come to the floor on our hands and our knees. So we're coming down to all fours and finding this gentle cat-cow. So again, if you were having really bad allergies and a lot of sinus pressure and putting your head forward just did not feel good, you might want to omit leaning forward. Conversely, leaning forward might actually be a really nice way to drain. And so if you're at home, you're not in a yoga class and you could just let it flow, this might be a nice way to use gravity to get that fluid out of your body. And then we can come back into child's posture. And again, this might be a nice spot if that this positioning felt good for that drainage. You can just rest here. You can also prop on your elbows, and this could be a good place to do some of those pressure points that we did in seated. Thumb hooked in the sinuses, doing the sinus massage in this position. So just knowing, kind of, you can come back to this. If, like, oh yeah, this does feel like it would feel good. Good, and then we can also do a little bit of gravitational positioning for the lungs. We'll do it passively, but this is just another way you can do it with your hips higher, and again, resting here. So not only are we putting more pressure down into the sinuses, but also helping the lungs to drain here. And the whole time you're doing this, you're in coming back to your breath. Your breath is your anchor. It's your litmus. It's that focal point which guides your responses. The ease of the breath. How does it feel to sustain those pauses? Is there challenge? And that might guide you to come out of the shape a little bit and find alternate positioning. Good, so now we're going to do some more passive proning. And so proning is, again, as far as with COVID and just some articles that I've been reading, one of the best treatments for this particular, where it affects our lungs, is proning, laying on the stomach. So there's a lot of different ways to drain the lungs. So in PT, I remember in my training, I learned all these different positions with gravity, depending on the upper, middle, lower lobes, the front, or the back. So depending on where you have the congestion, different positionings are going to be helpful. And some for like the upper lobes, just laying flat on your back will actually help to drain those. But for the lower lobes, it's not so helpful. So what I've read, and I'm by no means expert with this, but just taking some of that information and applying it to some of these techniques, the proning being on your stomach, and especially with the chest a little bit lower, is the most effective. I don't quote me on that, and please do your own research. And also, this class is just to kind of show you different posturings, and for you to assess, again, what are you feeling? How does your body respond? So with all that said, like you might need more upper respiratory relief, and laying on your stomach, it makes things worse. So you're just listening to your body. And again, this is best individualized, but for the purpose of today, this learning and discovering. So we can take the bolsters or the blankets, and we did this a couple classes back. So before we go into the drainage prone, we're going to go into more of a diaphragmatic release. So the bolsters are at the ribs all the way to the hips. So you're having this bony support to a bony support, and you're laying here. And your head is a bit lower. It can be on your hands or on the floor. And part of why I imagine the proning is helpful, not only what's happening with the drainage of the lungs, but also with this diaphragmatic release that we've been experimenting with. So as you're laying here, just breathing on your stomach. When you lay on the stomach, especially with a little bit of pressure, added lift, putting the spine in a little bit of flexion, it helps to release the diaphragm. It helps to really cue those back fibers of the diaphragm to open more, which will then cue the back ribs to open more. And also, as you're breathing into the back body, you're also all those tissues between the ribs. So we have little muscles between each rib that help to open the rib cage. When you're in this position, it's just able to access those tissues more. So we're just getting more opening of the structures that house the lungs. Just feel that here. So you could stay here for a while. We did a few other techniques in past classes if you want to go back and look at those. I think class number 2. Stay here. I'm going to go get my model now, and hopefully they will be compliant. So I'll be right back. You just stay breathing. And again, notice the pauses of your breath. And in this one, especially the exhale pause might be a curious place to linger. I'll be right back. No problem. Hey girls. That's okay. Come on in. So this is Linnea and Elise, the models. They're a little nervous. So Elise, will you lay on here like I showed you before? So Elise is gonna lay, before we were laying with the bolster here, kind of up at the ribs. Now we're gonna bring the bolster down lower, just at the hips. Here, sweetie, come forward a little bit more. So bring your head that way. There you go. So we're in a little bit more of an inclined positioning. Do you want to close the door, sweetie, so the kitties don't get in? Kitties aren't allowed. So just laying at more of this slope will give that really good release to the lungs, the drainage. If you find this is uncomfortable for your back, I found that like getting a little towel and rolling it up and putting it right under the floating ribs, so it's more of a gradient of support. So rather than all the support here at the hips and then just nothing, kind of slope it, putting another support under the ribs, a lower support. So you have this stepwise support. So you're just resting here, breathing, feeling the pauses. And then if you have a partner, somebody that can assist you, you can come back to that cupping technique that we did on the front of the body. So again, the hands are cupped. If you were to clap, you wouldn't hear anything. If your hands are flat, you would hear. And so doing the flat hands on somebody's back could be it could hurt, and it wouldn't get that same resonation and vibration and release. So I'm just going to be here, cupping and patting the leaves. So I'm finding the ribs, the base of the ribs, because that's where the lungs are. Starting at the base and slowly working my way up. You can get along the back, you can get a little on the sides. And you might, with your hands, be able to sense. Oh, I don't have my ear thing. Sorry. Could you guys hear all of that? I just realized I didn't have my ear thing on. Yes, okay. Doing our best here. Okay, technology. So we're doing this Therapeutic percussion massage. She's at a slope. We're going from the ribs on up. And we're doing both sides. So again, with your hands, you might be able to sense it feels more dense. It doesn't feel so resonant. And you might just stick on that side. Or they might tell you like, oh yeah, that's a spot. And it might make them want to try to cough. So you just stay on there for a little bit longer. Thank you, Elise. You're all done. So there's another position that Lene's going to demonstrate. Where you can lay on your side. So from here, laying on your stomach, you could be there for a while. I think it's recommended even 10 to 15 minutes for really good drainage if you're really, really needing it for the drainage therapeutic benefits. Otherwise, if you're just doing this just for finding relief of symptoms, your symptoms aren't really acute, you can come up, arch and round your back, and then we'll lay on our side. So we'll have our hip on the bottom of the cushion, our hands straddled. We did this in the first class, but we'll show it with the massage, and we'll show some variations of movement. And we'll lay on that side. And so we might need a pillow for our head if the floor feels far away, or especially if our shoulder feels congested. And if it feels good to lay with the head on the floor, that's fine too. So we're helping to really slope and open up the ribs. And also, again, we're in that decline with gravity. If this is just very uncomfortable with the cushions, you can also do it without the cushions. Maybe use a cushion in between your legs, a pillow under your head, and still being on your side, you're still getting that gravity, at least towards the floor, not so much at that decline. But we'll show with the incline. So go ahead and lay down, Lene, and lay facing me, okay? So put this hip on the ground. The other way. I'm going to be over on this side. You can put your upper body up here. Remember? There you go. Yeah. And a little bit more. Beautiful. I'm going to get her pillow. There you go, sweetie. So put this under your head. So say you're here and you have somebody on their side. So this just gives us more access to the side lungs. So you can do the same thing. And for the person giving the massage, it's easier to do this having them face you, because then you have just real good access to their back. Move along the back, along the sides. If I was on the other side, it's harder for me to get the back. It's just more awkward. It's easier to go around the front. So just little tricks. And also you can have your arm up and over. There you go. And so that'll help to really be able to give better access into that, all that upper side area. Okay, sweetie, you're done. Thank you for your demonstration. I hope you're hearing. Another slight variation of this, I'm just kind of going through showing variations, so it's maybe not so much a real experiential class as it is just kind of instructional with positioning. Is having our hips at the same level as our legs at the same level as our hips. So traditionally in PT, when we're doing this, we're on a table that the whole table slants. And so when your legs are higher, you're also getting that flow of blood and lymph. So you could take, I was experimenting with it. Cushions to lay your legs on. So you're up here. Your legs are higher than your heart. And you might need a cushion between your legs to support your back. And you're here. So you can experiment with that. Does that give any different sensation of release? Like an added sensation? And again, it's putting a lot of blood to your head. So if you have any pressure issues, you wouldn't necessarily want to do this one. So you can experiment with that. You might also want to have a cushion for your arm if you have shoulder needs. Just wanted to show that one briefly. And then I also want to show one more. So let's, we'll show it on this side and then we'll do the other side so that we're even. So adding a little bit of rotation to this side bend. So again, the height is just preferential due to how your body responds. So let's say we're here, just on the regular side bend. And we were getting the massage. So leaning forward. So we're in a half side, half prone. Like we call it semi-prone positioning. And we're slightly angled down. Again, we could do this without the bolster, laying on our side, and even just right here, we might have a cushion for our body to lean against. So all these little micro adjustments are getting different areas of the lungs to open up not only drainage of the lungs, but the surrounding tissues around the lungs as you breathe. Conversely, as if you go forward, you can also go backward into more of a rotation here. And so I think it was last week or 2 weeks ago, we were laying on our back without the pillows and doing this rotation. You could do your own self-massage in this one, or get someone else to do it for you. So again, what I suggest is see what feels like release for your body. So we'll go to the other side. And play with all the different positionings. So I know when I was pretty ill a few weeks ago, I just did this in bed. Going to bed, waking up, I would have my pillows. I would feel, oh, where does it feel congested? What feels like it needs relief? I would position my body, I'd breathe, I'd maybe do some self-massage. So we're here putting the cushions on our side, laying down. Again, if we were taking more time with these, we would really set it up with props between the legs. If you needed it, you're here. And so I had the girls here for this one, and we were doing the massage. You can even get to it yourself. And you're breathing, feeling those pauses. We also experimented with how it felt to have the hips a little higher. Did that provide more sensation of relief? Does it feel different on this side? And even if you don't have a partner to do the massaging, and if it's hard for you to reach to get it yourself, just placing your mind there. So let's say you have an area you're experimenting with, and you feel like it's like, oh yeah, that's a part of my lung that's, if I had a partner, I would really ask them to massage. Just put your mind there and visualize yourself doing this. Or just visualize holding your presence there and breathing and seeing if you get a release. So remember, you can come forward. We can also come back, just support your back, having your knees and your hips in more of a flexion rather than the legs out, supporting your back. So the advantage to having the pillows here is we get the rotation and the decline. If that's cumbersome for your body or it just doesn't feel right, again, you can do it just on the floor. How we did it before. Experiment, listen to your body. So 1 or 2 more breaths wherever you're at, and letting those pauses house your awareness. And then when we're ready, we'll slowly come up to all fours for a little counter posturing once again. And just see, how does my breathing feel? How do my sinuses feel? I also forgot to add, just laying on your side can clear the top sinus. So just bringing presence, like these different positions, have these areas in my body that need some sort of drainage, facilitation, support. How can my positioning affect sensation and affect function? And I'm here, and I could be even moving into the sides. And so throughout this series, we've been sort of ending on an incline, laying with our back on the props, which is also, again, some drainage for some of the frontal and upper respiratory. So we have some cushions here. Plus, it helps to open the chest. I'm just gonna show this briefly. So this is an option. Another option I'm going to show you for this last posture, if you want to try it instead. So that's a great one for if the sinuses just want to have an easeful position, and if it feels good in the lungs, feels good on your back. Another way is to raise the hips higher, and we'll go even into a full body inversion, which can help also with the lymphatic drainage as well. So we can take maybe 1 or 2 firm pillows. I would maybe add a little bit more than this, but just for experimentation's sake to start, you might have a little bit less. And you'll be actually putting your hips up on this. So it's like a supported bridge. So if you kind of sense, oh, I'd like a little bit more. Or you can even do it at a gradient as well, like we talked about before. So higher for the hips, a little less high for the low back. So I'm here, I'm laying down. And so again, you can think of what's happening to your organs, how they're affecting your diaphragm. You can think of what's happening to your lungs, that drainage. And then you can even take your legs up and even lift the feet towards the sky. So this is called Viparita Karani. If this is a little cumbersome to do here, you can also do it at a wall. So I would take my cushions up to a wall. I'll show it just the one. And I'll sit on my side, come up to the cushion, lay on my side, and then bring the legs up here. So this is also a variation. And again, being with your breath, whatever posture you're in, whether you're in the supported or the unsupported Viparita Karani or bridge, your legs don't have to be up. You can still get that therapeutic benefit for the upper body, even if the legs are down. You get that full body just prompt for more fluid with the legs up. Or you might be up on your incline, just feeling that opening in the heart. And stay about 6 more breaths here. Finding that ease of flow of breath, those little points of pause. I kind of like that visualization we started class with, that moving water. You might just have your mind on a beautiful stream of water in your mind. Mountain lake or brook. And being with that ease that is the water, it knows how to move. Sensing that deeper movement beyond the waters of your body, just that deeper movement of energy, of life force as you breathe. So finishing that last breath there. And then we'll slowly take ourselves to our side. And we can do a full relaxation on our back. So a few more breaths here, resting in Shavasana. Just allowing the ease of this practice, its effects on your body and being. And so now when we're ready, we'll slowly make our way all the way up into seated. So just take your time as you transition to your side and all the way up to seated. Feel your hips at stable, supported base, and feel how the spine aligns over that support. Just tapping back into that presence of you're resting on the ground. And so, like one of the breathing practices we did earlier in class, we'll do the alternate nostril. So we'll start with just the inhale, like we did before, just to check in and see the difference in your sinuses and your lungs. And then we'll do the full alternate nostril breathing if it feels comfortable for you. You can always remain with the partial. Having your hand ready, we're going to be inhaling, closing the right, inhaling through the left. A little pause, feel your body preserve that air, and then exhale through both nostrils. Let your body soften a bit. And then the other side, close and breathe through the open airway. Do that about 2 more times, just sensing the openness. Imagine this evening out between sides. If you want to refine this practice, taking even smaller sips of air, you can even partially close the nostril you're breathing through. So you have the one that's fully closed, and if everything feels really open and easeful already, you can partially close the open one and take an even more refined sip of air. This is a more advanced practice if this feels unsupportive to you at this time. Just omit it. Otherwise, feeling that deeper experience it brings you to. And so you can continue with this for 6 more breaths, or you can do alternate in and out. So we would be inhaling on the left and then switching, exhaling on the right. Staying, inhaling on the right. And then switching, exhaling on the left. Staying there, breathing in. And always switching after the inhale. Feeling those pauses support your awareness, support your experience. And just like we could visualize the massage, if doing this causes aggravation, you can just rest your hands on your lap and just visualize the air coming in through one nostril. Visualize it coming through the other. Imagine you had that control, that valve in your mind, just moving the energetic behind the breath. Finish 1 or 2 more breaths here. And so you would finally end on the right nostril when you get there, exhaling on the right. And just notice that flow of air between both nostrils. Notice that energy, the sensations moving through your whole body, receiving this beautiful air. And so finally, we'll take our hands, those cupped hands together at your heart. And just sensing that space between the palms, that cupping space you're holding, that you gave yourself massage with, that you held your eyes with. Imagine that energy in your palms, that loving touch, transferring back into your body, through your sternum, into your heart, into your lungs, into your blood, into your whole being. And thank you for sharing class today. Namaste. And feel free to give yourself a big, big hug. Thank you all. And I was going to add too, if you were curious about more, like really getting specific about these positionings for the lungs, you could just Google lung drainage physical therapy positioning. And I hate to just send the world out to Google because sometimes there's misinformation out there, but it's a pretty steady work. And so likely if you, maybe you can check your sources so that you see like, okay, this one that I'm reading is the same as this one and this one and this one. And I wish I had like a good referral source right now. I can't think of anything offhand. I can let you know later. But it will show you the exact positioning. You're here, and what part of the lobe of the lung is helping to drain. So if that is something you're curious about studying more, or maybe you've been diagnosed, or your right middle posterior lobe, if it's a real specific location in your body and you want a specific therapeutic positioning to release it, that can be helpful for you. But I'm also, and that might be indicated for you, especially if you're in a really acute place. Like, don't mess around if you have really acute respiratory symptoms. Seek a doctor. But if you're, uncomfortable and you're having symptoms and you're just wanting some ways to find relief, I'm a big fan of intuition and listening to your body and let your body tell you, oh yeah, I can breathe easier here, or oh wow, I feel that relief sensation of pressure changing in my face. So you have a lot of tools. Just curious, trusting, listening mind, and let your body guide you. And hopefully that was helpful.
Yeah.
Thanks, guys.
Thank you, Laura.
Any questions?
Oh, that was great. That was great.
Cool. And you guys got a little concert from John.
Oh, we didn't really hear it.
He didn't realize that I still had class, so you guys got some Cuesta music.